So we welcome you to the program, ma'am, and we are glad you are here with us. It's over to you, ma'am.
Oh, thank you. Thank you so much for this opportunity. So I know already you had a very long morning already, and I'll try to make it short and interactive. So yes, you can move to the next slide. Yes. So I just want to start this presentation with a positive note. You deserve to be happy. And you always have the choice available to you. So I know that all women especially are multitasking and there is a lot going on. So I just want to start my presentation with a positive note. Yeah, next slide. So yes, you can click. So there are a few things that I want to focus. One, the goals would be to help conversation about mental health in women. So normally there is a stigma to start to open this conversation about mental health in women. I want, by the end of this presentation, I want you to be able to recognize the signs and symptoms of mental illness and to understand the barriers in treating mental illness. And finally, I want you to know how you can be helpful to others and how you can help yourself when you are going through a lot of emotional trauma and things like that. Next slide. So what is mental health? So mental health includes our emotional, psychological, and social well-being. And there are a lot of factors that contribute to mental health. One is our genes. Definitely genes have a role in how a person thinks. And life experiences, especially in women, a lot of them like child abuse, sexual abuse, traumatic experience, those can have an effect on their mental health, and family history of mental problems. That also plays a role. Yeah, the next slide. So the prevalence of mental disorders, like 27% of adult population, they experience at least one mental disorder in a year. And the rates are significantly higher in women than in men. So in women, the overall rate is 33%, whereas in men, it's only 21%, except for a few disorders like substance abuse disorders, like alcohol and drugs. Those things are more in men when compared to women. Next slide. Yeah, before this, I just, there was one more, a few mental disorders I just want to focus before moving into this. So if you take into depression, depression rate is twice as high as in women when compared to men. And phobias, like some people would have phobias to like water phobia, phobia like claustrophobia, those kind of things are similar in men and women. And the next thing is when you look into like eating disorders, that's 85% of the patients who are affected with eating disorders are women. And suicide attempt is actually more in women when compared to men. But the actual rate of suicide is more in men when compared to women. So before going into the details of mental disorders, I want to share like a quick YouTube video seeing how different men and women's brain is. If you could click the link in this slide, I think you would be able to see that YouTube video. Now, if you are not able to click into this slide, that's okay, but I can go over what it is. So generally, in women's brain, there is an area called corpus callosum, which is supposed to be like the bridge. And in women, that area is really big. So it sends connections to different parts of the brain. And so women's brain is more like entangled, like lot of wires, like tangled wires. And so women have a lot of emotions going on at the same time, whereas men's brain, it's more like boxes and grids. And so they can think straight, but if you ask them to connect the dots and to connect different things, it's difficult. And also women are more expressive, and because of the same connection, women are good at multitasking, and they are very emotional. Women can remember, there is an area called hippocampus, which is also more prominent in women's brain. And so they can remember things that happened a while ago. And especially hippocampus focuses on emotional things and stuff like that. So generally women tend to expect a lot from men in terms of emotional connect and things like that. But I think it's not to blame them, and it's vice, because that's how their brain, that's how their anatomy is. It's more like grits, and they can think straight. But if you ask them to connect the dots, and if they are good at math and stuff like that, but if you try, if you tell things to them directly, they would understand. But if you are trying to tell them indirectly, yes, some men do understand, but not all of them. And it's because of how the structure is. And similarly, because of how the connections are in women's brain, we are more prone to a lot of mental disorders. Yes, you can move on to the next slide. Yes, so there are many other reasons apart from the anatomy of the brain. One is hormonal changes, especially our estrogen and progesterone. They have a great role in maintaining our mood, and women can go through a lot of emotional disturbances or mood swings before their menstrual periods, like right after delivery, and also right before their menopause. And there are like psychological distress associated with reproductive health condition. Now infertility is becoming more common, hysterectomy is becoming more common. So all these things can also affect our psychology, or affect our emotional quotient, and anxiety over our body image. And the next point, I don't think it applies to the faculty there at NIT, like low income and lack of autonomy and control over one's life, which is in general more common in women when compared to men. And there is, like I said in the previous slide, there is a strong association between being sexually abused in childhood and the presence of multiple mental health problems later in life. Yeah, can move to the next slide. And so now, why are we afraid to talk about this mental health? So one is how there is a stigma, like people view you in a negative way when you open this conversation about mental health. And they call you by different names, like you're crazy, you're weirdo, you're wacko, and psycho, all these names. So that's the reason a lot of times people are afraid to open about mental health. Yeah, the next slide, please. So yes, and other barriers, of course, poor cultural understanding, that's actually number one, I would say, and lack of access to care. And now it's becoming more available, but in general, if you're looking for a doctor to treat for general health issues like fever or diabetes or high blood pressure, it's more easily available. Whereas if you're looking for a psychiatrist, a lot of times you might have to do a lot more research in reaching a psychiatrist. And they are in general worried about taking medications to treat any psychiatric illness. Yeah. Next slide, please. So though there are a lot of mental disorders, I want to focus on a few mental disorders because depression is number one mental disorder that we are dealing with in women. And I just want you to be able to recognize the signs of depression. One, you can complain of, and these signs apply more or less. A lot of the symptoms would overlap even for anxiety and depression. If you compare the symptoms, a lot of times these symptoms would overlap. So mainly in depression, like headaches, general aches, women would complain of a lot of body pain, digestive problem, and lack of interest in activities that they used to enjoy, and problems with memory, and trouble falling asleep or staying asleep or sleeping too much. These are some of the common symptoms. And next slide, please. And eating too much or not wanting to eat at all, or thinking about or attempting suicide, and experiencing like feeling of guilt, worthlessness, helplessness, hopelessness, and sometimes you can be really irritable and you're getting angry for things that for even normal things. Those are all some of the common symptoms. Yes, next slide. And one thing I want you to remember, feeling depressed is not a sign of weakness. And it's not always easy to talk about it. And it takes courage to speak up. And one thing, when it's normal for any individual to feel low. And just when you feel low, just think in your mind, it's okay to not to be okay all the time. We don't have to be perfect, and it's totally fine. Yes, next slide, please. Okay, so I want to talk about how can you be helpful to someone with depression. So if you are noticing your friend who is looking abnormal, or who you think is somewhat not that original self, reach out and just, but be careful with how you address it. Some things, some of the way that you can reach out would be like, I've been worried about you. How are you really? And I have noticed some changes in you, and I just wanted to check with you. And I understand that you're having a hard time. And when did you start feeling like this? Did something happen that started it? Or how can I help you to find help? So just be open, be those listening ears, and be that friend who will not judge them for what they are. Yeah. Next slide, please. This is really, really important. Don't make your friend regret opening up to you. This is one of the things that why women in general, they are afraid to open it. Because generally, if they talk to another woman about that problem, generally the news gets spread easily, and that's their worry. So don't make your friend regret. Be those listening ears and be that trustworthy person. Yeah. Next slide, please. So when somebody is talking to you about how they are feeling, do not say these things. When somebody is telling that they are feeling low, they are feeling depressed, don't tell them it's all in your head. You're just having a bad day. I'm sure nothing to worry about. And why are you talking things like that? And you don't want people to think you're crazy. And what will your family say? Don't try to throw these kind of terms. Just be more understanding. Yeah, next slide, please. And this, I want you to remember that, like any other illness, like fever, depression is treatable and recovery is possible. So it's not something like, if you have depression and if somebody start you on medication, it's not like you're going to be on that medication forever. Generally, when somebody is feeling depressed, they start you on a medication and they want you to continue that for a good 2 years. And they want you to be symptom free for a good 2 years before weaning you off it. And when you start treatment for depression, they generally say that you should not like start or stop treatment abruptly. It's a gradual process. And if you are taking medications for depression or any mental disorder, just make sure that you gradually start the treatment. And when you decide to stop on it, you don't stop it suddenly, because you can go through withdrawal symptoms if you stop those medications. But before putting somebody on medication, talk to the doctor about other options like counseling and psychotherapy. Those things should be the first step, and that would be step before starting somebody on medication. Yes, next slide, please. And I just want to focus on two more mental health disorders. One is baby blues, which is specific for women, because most of the women who are working, most of them are in the reproductive age. And so baby blue is something that happens right after delivery because of hormonal changes. So it's the feeling of sadness and surges of emotion that occurs few days after childbirth. And women would feel happy for 1 minute, and then they would become tearful for the next. And it normally lasts only for a few days, but it can go up to like 2 weeks. Yeah, next slide, please. And as I said, it's caused by hormonal changes, like our level of estrogen and progesterone drops suddenly after delivery. and this can affect the mood. So generally the hormones would level off within a week or so, and you should feel back to normal without medical treatment. Next slide. So coping with baby blues. So new moms should try to just accept the reality. That's rule of thumb, and be how do you and be ready to accept help if someone is trying if offering you help, or if they are offering you to run errands and prepare meals and things like that. Say okay with full heart. And good nutrition and plenty of rest is important, and talking to other new moms or family or friend, that can also help you feel supported. One thing I want you to remember, if your symptoms last for more than 2 weeks, make sure you talk to your doctor, because you want to make sure that you rule out depression, postpartum depression. Okay, next slide. So postpartum depression, it starts like baby blues, but these symptoms that are more intense and longer lasting, and it can affect the way that the mom cares for the baby. So they generally feel it very painful, and in times where they should feel joyful, and a lot of times they are reluctant to talk about it to others. And it is a medical condition, and I want you to remember, like after delivery, if you have these symptoms lasting for more than 2 weeks, please make sure that you talk to your doctor about it, because it can have effects on the baby as well as on the mom. Next slide, please. So these symptoms are, again, it is similar to how you feel when you are depressed. Insomnia, like not being able to sleep, you feel tired, intense anger, severe mood swings, difficulty bonding with the baby, and lack of joy in life. Yeah, next slide. Yeah, and feeling of shame, guilt, and withdrawal from family, lack of interest in sex, and thoughts of harming self or baby. Yeah, next slide. So what are the causes for postpartum depression? Definitely, other than hormones, our hormones have a huge role. The level of estrogen and progesterone adjusting after delivery, and sometimes, and also our blood volume kind of shrinks after delivery, and there is a lot of changes that's happening in the mom's body. So sleep changes, sleep deprivation, anxiety about carrying a newborn, and they feel exhausted, lack of support from loved ones. Sometimes when they are having problems with breastfeeding, they can feel really tired with that, and a demanding baby. There are many causes why a woman can feel that way. Yeah, next slide. Yeah, the again, lack of support system, marital problems, and if they have a history of depression, and if they have a history of some trauma in the previous year, like loss of job or a difficult pregnancy or an unwanted pregnancy, all those women are at risk of getting postpartum depression. Next slide. Yeah, why, like I said, it's really important to seek medical attention when you feel this way, because it can affect the mom and the baby. So babies of mom who have postpartum depression, they can have a lot of problems like temper tantrums, hyperactivity, and the baby can develop delay in language development. So it's really, really important that you seek medical treatment. Yes. And for the mom, if they don't get it treated, this postpartum depression can progress into chronic depression. And so it is really important that mom seeks medical attention. Yeah, next slide. So I just, apart from medications, I now want to focus on about maintaining positive health. One is faith and spirituality can have a huge role in healing. So they say that the first 45 minutes after you wake up, irrespective of what time you wake up, that's really, really a precious time on your day, because your memory is consolidated after a good sleep. And how you utilize the first 45 minutes in the morning, that has a huge role in on your mental well-being. They say don't I myself, I have the habit of looking into my phone as soon as I wake up, which I'm trying to cut back. And they say don't look into gadgets the first 45 minutes. Wake up and maybe like take a shower or spend some time with meditation or prayer or some sort of spiritual activity or yoga that will have a huge role in your mental well-being. Next slide. Okay, so this slide should have come before this is some ways like how mom should help themselves with treating postpartum depression. So they say a lot of things that new moms can do. Focus on simple pleasures in your daily life, like sipping a cup of tea. Sometimes a new mom, they don't have like a schedule for themselves, and that can be really depressing. So just have your me time and focus on things to look forward. And you have to accept help when it is offered and rest when the baby sleeps. That's really important. Rest. Yes. Next slide. You can move to the next slide. Okay. So some other ways like how you can maintain positive health. One, I would say, keep in touch with friends and family who can be of emotional support. I would say, like, have that friend who you can call at any time. Like, have that 2 a.m. friend you can call to and chat with them. Sometimes all that's needed is talking to a good friend. They don't even have to, like, talk to you and support you on what is going on, but having like a nice chat with a friend or a family member, that can be really, really helpful. Like I have a friend that I talk to when I feel low, and we don't even talk about the problem. Sometimes you just talk about some general things and you just feel better after that. And one of the next thing I would say, accept the reality and develop a community. So, previously the social media was not that much, it didn't have a huge role in our day-to-day life. And when we grew up, we had like a lot of neighbors, friends, and there was a lot of drama involved in our life we used to play in the streets, but now it's not like that. Everything it's more like a peer pressure of posting things in social media, and there is a lot of comparison. So I would say have like a real-time friends rather than online friends, and develop a community, and that's very important. And next thing is have your me time. Like sometime that's totally where you focus on yourself, like go get a massage or go get a facial or go for a walk or just read a book, or so have your me time. That time is designated for you and you do what you want at that time. Yeah. Next slide. And this is, as you all probably know this person, Indra Nooyi, former CEO of PepsiCo. So I always listen to her speech when I feel like I randomly listen to her talk. And many of you would have listened to her speeches. And what she tells is the biological clock and the career clock are in total conflict with each other in women. Yes, by the time we want to focus on our career and and get better in get to a better position in our career, that's when our biological clock clicks into, and that's when women get pregnant. And can we have it all? And the answer that she says is on a relative basis. Yes, we can have it all, but at the same time you need to be open and accept the reality that it's okay to not have it all. Next slide, please. This is something I learned from her. Don't die with guilt. So yes, on a relative basis, when you have like a good husband, a good support system, and a decent job, yes, and like a will to power through difficulties, yes, you can definitely try to get it all, but it involves a lot of trade-off and a lot of sacrifices. It's not easy. Like you go through a lot of pain to achieve what you want, and you should develop some coping mechanisms. You don't have to like die with guilt. Like most of us try meticulously like to be like very good parents and try our best to provide the needful to our kids. But when you ask them like if our kids really do appreciate of what we are, The answer is not always. If I ask my daughter, is mom doing the best? She would say, yeah, but that mom did this thing. She went to that thing. The first few times, definitely, I had that guilty consciousness when I heard that, because being a working mom, sometimes it's really hard to be in school for all those random activities and stuff like that. But it is okay. You just tell your kids what you're doing for them, and don't die with guilt. You cannot do it all, and definitely there will be a lot of trade-offs, and just remember that in your mind and be thankful. Just one other thing of maintaining positive health is to be thankful. Just be thankful of your upbringing, and just count your blessings. Just and be thankful to your maid, or just try to keep that positive vibe around you. And that is instead of complaining, try to complain less and be thankful. And that has a huge role in maintaining our positive health. Yeah. Next slide, please. And this is really important, like engaging in physical activity every day, even for new moms, as well as in general, for maintaining positive health. Physical activity has a huge role, because when we engage in physical activity, there are a lot of chemicals that are secreted in our brain that helps to produce some positivity. So engage in physical activity. And the next thing is really important: saying no to new responsibilities when your plate is full. So feel free to say no. If you have a lot going on, feel free to say no, and rather than exhausting yourself. And getting enough sleep. Have a good sleep schedule, like going to bed on a particular time, waking up on a particular time. And sometimes, even when you don't feel, even if you feel like waking up in the middle of night, try to develop that practice of not try to just lay on the bed. Over a period of time, that will become a habit. And don't use your phone before going to bed, and don't watch TV and right away go to bed. So these are some things that we can do on daily basis to help ourselves. And finally, seeking help from a mental health professional when stress becomes overwhelming. That is also very important. Okay. Yes. Next slide. Yeah. So this ends my presentation. I kept it short, and I'll be happy to take questions at this time. Thank you. So how do I take questions now?
Ma'am, participants will type in the chat box, ma'am.
Okay, so I'll open the chat tab. Any good remedy for tension? It is, I would say it is, a lot of things can help. There is not like one solution. It depends on the problem, but involve in some sort of physical activity on daily basis, and have a schedule. Be it whatever your day is, have a regular schedule, and make sure that you have some time for physical activity, for some sort of meditation, and have your me time. Do things that you enjoy on daily basis. And if you feel like it's becoming really hard for you to handle it, I would say at that time try some counseling. But a lot of times, I myself, my husband says that I'm type A lot of times, but I feel that it's normal, because we tend to do it. We want it all to be done perfectly. But I would say it's okay to not be that way. Try to accept that reality. But otherwise, I would say physical activities would be like a very good thing for tension. Yeah. And any other question?
Ma'am, one participant is asking how to overcome guilt.
Wonderful question, actually. So try to develop coping mechanisms. One thing that I listen to Indra Nooyi's conversation a lot, and I also listen to Sudha ma'am's conversation. So one that she says when her child complains that this mom attended the teachers conference, this mom attended this party in the school, she used to have friends with other moms, like working moms, and they say, no, this mom did not attend, this mom didn't attend. So try to develop a community who can be supportive of each, with whom you can relate to. And other thing is, with which I listened from Sudha ma'am, she says, accept your husband as he is. And it's not just with husband or with kids. Just accept the reality and let go of, and just understand that it's okay to not have it all. It comes with a good trade-off. So there is no like one solution for any kind of like tension or guilt, but it comes with practice. It doesn't happen in one day, but it comes with practice. Like develop a code, have your friends and community who can be of support, and understand at the end of the day, your health is the most important. How much ever you do to your kids or family, I think at the end of the day, when you lose your health, I'm not sure how much our immediate family is going to be of help to us. So keep your health as your priority and do what you enjoy. Make sure that you have some me time on a regular basis, like once a week at least. And one thing I say for tension, this is one thing that I have read a lot and I have felt a lot: have at least 3 vacations in a year. Once, it's really important, like getting away from your daily routine, getting away from your home. That has a huge role. Like even for like a weekend or something like that, make sure that you have at least 3 vacations in a year. That is really important for rejuvenation process, and it's more like retreat for us. So vacation is one thing that's really important.
Ma'am, next question is from Megha. Which group of diseases is identified as psychosomatic diseases, not psychological? And what is it we can do for them?
So psychosomatic disorders are like bipolar disorders, schizophrenia, even sometimes depression and things like that, they would say as psychosomatic disorders. And I would say those things are more tricky. And when you see someone with psychosomatic disorder, you have to be those listening ears and try not to judge and try to gain that trust. But definitely they would need medical attention and treatment. Yes, they make sure that they go see a doctor, because that's a lot more complex and definitely they need medical attention.
Yes, ma'am. And the next question is from Bharti Sharma. How
Okay.
to deal with the overburdened at workplace?
So say no when you feel overburdened. Like make sure that you take your breaks, and make sure that you don't stretch yourself beyond. And what kind of work are you talking about? It's really important that you have good breaks, and making sure that you are not doing for more than what you're paid for. A lot of time that happens at workplace. So one thing is to say no to responsibilities if you feel overburdened.
Okay, yes, ma'am. Next question, ma'am. From Hamrita. If the reality puts you down, then what to be done?
The reality puts you down. Talk to a friend, go with the flow, accept it, and take your time.
Yes, ma'am. Okay, next question is from Dr. Sunita.
Mhm.
It is not possible to be perfect everywhere, but expectations are exactly the same. Demand of to be perfect everywhere. So how we can balance?
See, make yourself one thing that I have seen in my workplace while I was in residency. When I was in my medical training, you are expected to work for like 36 hours and 48 hours in a row. and while you are pregnant at that time, nobody, you just have to be tough at those times. I understand how it can be, but just accept the reality and make yourself indispensable at the workplace. Like it's not always possible, and overburden and depression and the overburden, exhaustion, and all these things are very common. And try taking a break. That's one thing that I really recommend, because sometimes when I have to do that, and there is nobody really care. They want cares if you're pregnant or not. They want the work to be done, they want the job to be done. And when you choose to that, when you give that commitment to work, yes, I just try to talk to myself and say that no, that's what is expected, and we have to go with that flow. And yes, I have felt exhausted and things like that. And sometimes you have to power through difficulties, and then take a break. And during those times, break was not possible, and I had a good support system, like talking to somebody, like venting out to somebody, and having a good rest. Try to have your community and support system to whom you can talk to, and who won't judge you. I think those things can be helpful.
Yes, ma'am. There are a couple of more questions, ma'am.
Yes.
Next is from Neetu. How to talk to the person who is in depression? How we can support them?
Um, So ask them what's going on, and ask them, are they really okay? And when they talk about a problem, listen to them, and try taking them out for a walk and do some activities with them together. Which can sometimes I have seen like few of my friends who go to like evening time, like art event or something like that, where they just it's like drink and you paint and stuff like that. And and try to spend more time with them, like taking them out and doing things which they enjoy. Some do enjoy shopping, some do enjoy going to temples, some do enjoy having like a good meal and not being responsible to cook for others and things like that. So try to engage in activities that they would love to. And if you feel like their symptoms are getting worse and you're not being of help, just talk to them like, hey, why don't we just go and talk to a counselor and see what other options we have? Because a lot of time now there are a lot of cognitive therapy and things like that, which can be helpful before you start someone on medications. So be that friend who will not judge and who will be supportive.
Yes, ma'am. Next question is from Jyoti.
Mm.
How to deal with mood swings?
Mood swing is really really difficult to deal. Like um, definitely, like I would say, when I talk to some of my regular friends or family members, I can say when they are going to have their menstrual periods, because the way they talk and the way they approach is totally different. But those times, I would say, don't take any important decisions during those times, and try not to say anything to others, even if you feel very strong about it. Especially if somebody is taking like birth control pills or things like that, mood swings are common. And before menstrual periods, mood swings are common. If you feel like you're having mood swings, and if you feel like it's close to those hormonal changes and things like that, don't take any important decisions at that time, and give your body some time. It will probably settle down within a few days once those hormones level off.
Yes, ma'am. Next question is from Meenakshi. What to do when you are misjudged?
You don't have to prove it to others. Sometimes it doesn't help, because whatever you cannot help on how others are judging you, and that's just, remember, that's not your problem. You do what you feel is right according to your consciousness, and go with the flow. Because if you try to please somebody, and if you try, it's really not possible to be possible to be in good books for each and every one. So do what your conscious says is right, and go with the flow. do because that is not under your control. First of all, there are a lot of things that's happening in our body, which itself we have a hard time controlling. And controlling how another person feels about you, that's definitely not under your control at all. And understand that's not your problem too. This happens a lot in workplace, where you get misjudged, and it is sometimes even in my profession, this is very, very common, where they try to point fingers on each other. And sometimes you be deaf. Sometimes you be deaf to it and just do your work and move on. And eventually they will realize, or even if they don't realize, that's not your problem.
Yes, ma'am. Next question. Is there any benchmark for the workload in any institution?
They say like up to like 60 hours a week. I don't remember the exact numbers at this time, but that should be like specific hours beyond which, like in my, I can only relate to residency. At that time, they say that you cannot work continuously for 7 days, and that should be like a 12-hour break in between. But now I was listening to the previous speaker who was talking about women's right and things like that. I don't know if they mentioned anything about the workload, but one thing I would say, as faculties, you are all involved in teaching profession, and when you stand for a long time, make sure that you don't make sure that you keep moving, because standing for a long time, like more than like 6 hours or 8 hours, is not good for our health. I would say make sure that you wear, it can put you at risk of heart problems and things, and back issues and things like that. So I would say make sure you wear like comfortable shoes, like back belts and stuff like that. And moving yourself, and try to sit in between, because when you stand for a long time, blood gets pooled in your leg, and women can become at risk of heart problems and stuff like that. So those are things that I would be careful at workplace. But I'm not exactly sure of the cutoff, like for how long you can work in a particular week.
Yes, ma'am. Okay. Next question. As a working mom, we take steps to facilitate our kids a lot. Grown-up kids are not responsible for their actions and complain us, making mom feeling guilt. How to overcome this?
Develop coping mechanisms. It is really, really hard. Like sometimes I feel like I'm the best mom and I'm doing all these things to my kids. Yes, they do appreciate, but not all the time, and it really, really hurts when they say that you didn't do that. And sometimes I argue with my daughter and I say that I've done so much things for you, won't you appreciate that? Won't you still, would you still pick on these things? But the one thing that I have realized, they will grow, and they will move on, and I have my own life to live too. Just remember that it's they will move on beyond a point, and have your passion, have things that you love to do on daily basis. Develop a hobby, be it like gardening or cooking or painting, or develop your or photography, or just traveling and things like that. Make sure that you do some activities just by yourself and with your friends, and make sure that you have a life, even when your kids are not there. One thing that my husband always says, I'm a working mom and I always go beyond after my kids. And sometimes when he asks me, you don't have a hobby or anything like that, right? You're always behind the kids. And I felt it was true. And that doesn't end. Sometimes he asks me questions. So what are you going to do once your kids goes to college? I can that time it was like a awakening call for me, because I can feel how empty I would feel when my kids leave home and things like that. So that's when I realized that I need to enjoy things that I like to, and do things that I like to. And one thing I would say, for all these for all the questions like tension, guilt, and all those things, rule number one: accept the reality. And like you Applaud yourself for doing the best you can. You cannot have it all, but on relative basis you can. Maybe like at one point they would realize, but that's not your problem. You be true to your consciousness and do what best you can do. That's all we can do. Mhm.
Yes, ma'am. What can one do to stop giving undue importance to troublemakers in personal and professional life?
Ignore. Ignore. That's I have faced it too, and when you face it, it's very difficult. It's easier said than done. I would say don't do anything impulsive when that happens. Don't react right away. Just sometimes you might get an email which is really provoking and you want to like reply to it right now and then. Don't do that. Just just think about it. One thing that my nurse always says me, don't be impulsive when something like that happen. Just take at least 2 days time to process it. Give your mind and body some time to process it. And I would say those are people misjudging you and troublemakers. They are going to be there and you cannot do anything about it. Sometimes ignoring and doing your own stuff and standing up for yourself. When it's time to talk, talk confidently. And sometimes one thing, ignoring is one thing. The other thing is sometimes people take you for granted. And sometimes they put you in a place like they feel like you wouldn't react or do something if they keep how much ever they trouble you. At that point, I think it's important to step up and talk to your higher authority or somebody other than that person. Either confronting with that person, sometimes it can be helpful, but not all the time. But otherwise, I think it's important to step up and voice it out. Yeah.
Earlier one, that is because of my job, I have to stay in different place, and my daughter always compared me with my sister-in-law who stays at home, and she always wanted me to stay at home. How to make her understand?
Um, Talk about the financial benefits you bring home. Talk about take her to a good vacation. Yes, when you earn more, you have more financial freedom to spend as well. And tell them how much more you can do for them because of the money you are making. And yes, my sometimes they do compare, and sometimes I have to compare my kid with her friends, and and I have to say this is how I feel when you compare me with someone else. So just sometimes it's, long story short, it's not possible to satisfy everyone. So you be true to yourself and you accept the reality. And don't if you're try talk them about the financial benefits you bring home. And at one point, like I have my friend who has told me this. Her mom was a working mom and who sacrificed her career for taking care of the kids. And beyond a point, the same my friend was mentioning to me that she was telling her mom, I was a kid. Why were you paying so much attention to what I said at that time? You shouldn't have left your career. You should have focused more on your career. So, and I could only imagine how her mom would have felt at that time. So eventually your kid would understand, but don't expect them to understand it right away. It's a process. Any other question?
Able to hear us?
Yes, I do now.
Okay, ma'am, last question, ma'am. I am facing leg and knee pain. Please advise.
So it depends on how much you weigh. And it depends on whether you have any back problem going on, because any back problem can also cause like shooting pain to your legs, especially if you have developed any injections in your back or any surgeries in your back. Weight reduction would help, or it also sometimes it can be a touch of arthritis as well. Weight reduction and exercise would help, like weight bearing exercise would help with knee and leg pain. But there are different types of knee pain, like and leg pain. One can be like a neuropathy, where it is like shooting pain. At that time, make sure that you check your vitamin B12 levels, your vitamin D levels, and make sure that your potassium and all electrolytes are okay on in your blood. Have a regular blood work at your doctor's office. And other things I would say, one, it could be neuropathy, and one, it could be touch of arthritis. If you are having like symmetrical joint pain or stiffness in your joints, say if you have like symmetrical pain in your knees or symmetrical pain in your foot, and if it is more in the morning, there is a possibility that you're dealing with some sort of autoimmune disorder as well. And pay attention to your symptoms. If your symptoms are getting worsening as the day progresses, it could be like a general arthritis. But if your symptoms are worse in the morning, always remember that that could be like a touch of autoimmune process that's going on in the body, and talk to your doctor about it. But on general basis, if you're thinking it's something not medical, I would say weight reduction, daily walking would help. And make sure sometimes taking a multivitamin on daily basis, that would also help. And one thing is vitamin D level is also one thing that's low in a lot of us. So make sure that you get all those things checked.
Ma'am, there are a few more questions which are coming in. Will you take it?
Yes, go ahead.
Yes, ma'am. Most of the women are stressed in house and workplace. How to handle and control partner stress situation?
Partner stress situation, you mean like your partner bothering you, or I'm just trying to understand. Oh, is your partner, are you talking about like your partner's expectation?
That's all is mentioned in the
Oh,
question.
okay. So partner's expectation, that's something we all face, right? And maybe they also do face that, do feel that way. And just remember, that's how their anatomy is. It's hard for them to understand certain things. It's yes, our husbands are good. They do the best they can, but at the same time, if you want like a surprise for a birthday, or if you expect them to cook or bring medications or something like that when you're not feeling well, or to take care of the kids, they don't really get it unless and until you voice out. I have to actually tell my husband, sometimes I might be coughing or doing something, but he's good in general, but they don't get it. So I have to declare, and I have to say, hey, I'm not doing well. I need you to take care of these things. And that helps sometimes, because if you talk to them directly, they understand. But if you have these indirect expectations on them, it doesn't work always, because that's how their anatomy is, that's how their brain is. But generally they are less, there is not much drama involved with men. So but at the same time, they don't understand all our emotions well. So that's one thing. And one other thing that I have seen, like some men, the way they abuse women, and how sometimes when they make you feel worthless, saying that you're not doing nothing, I'm doing all the work and things like that. I would say just keep your expectations low and try to do things what you love. Like I said like I said before, you cannot do much. You don't have much control of how others are feeling about you. But if you keep doing what you're doing, and if you feel like you're true to your consciousness, go ahead with that, and things will fall in place. Next question.
Ask them to complete and pursue their passion later. But I feel I am doing only lip service. What can I do?
Sorry, I didn't get the question correctly.
There will be some students who are forcefully put into engineering because of their parents. So, but they are not interested. So, the participant is asking what she can do for them.
What she can do for them. Um, it is hard. It is hard to do what you don't like. It is definitely hard. And I have my family member who did engineering who was not interested in that, but after that they didn't pursue that. They did what they wanted. So I feel sorry for those kids for doing what they don't like to. Um, is there a way of adding things that they would love to add fun to the subject in engineering? Since I'm not in that field, it's kind of hard for me to answer that question. But what is their interest? Is there any way of incorporating that interest into engineering? Because the person that I'm talking about was interested more in like visual arts and stuff like that, and they ended up doing those videos and stuff like that after graduating from engineering. But I don't know if program can incorporate things that would add more diversity to the curriculum.
Yes, ma'am. That was the last question, ma'am. That's all.
Oh, okay. All right.
Shall we wind up, ma'am?
Yeah, so thank you so much for this opportunity, and I hope this was helpful for you. And one thing I would say, take one day at a time. It's absolutely okay to be not okay, and feel free to say no, and develop your community. Make sure that you have your friend circle, and make sure that you take enough breaks, at least 3 good breaks in a year.
Yes, ma'am.
All right. Thank you so
Uh,
much.
Ma'am, okay. Yeah. So, not all angels have wings. Few have stethoscopes too. So, you were such angel who motivated us and made us realize you are more precious to this world than you ever know. Thank you for taking your time off amidst your busy schedule and sharing your priceless knowledge, ma'am. Have a nice
Thank
day
you.
and have a great year ahead, ma'am. Thank you.
Oh, thank you, and Happy New Year to everyone. So just make sure that you stay happy.
Yeah,
Thank
thank
you.
you, ma'am.
All right. So I can leave this meeting now.